Hello viewers, welcome to another vlog. You are watching Pathology Discussion Forum. I am Dr. Joydev. I am a consultant pathologist. Today's topic is circulation of spleen or splenic circulation. Now, as we know that spleen is an vital organ for our body. It lies in the upper abdomen just below the ribs, and it usually weighs about 150 to 250 grams. It is its normal weight, and its length is 5 to 13 centimeter. Whenever it is within this range, then the spleen is usually not palpable. When it becomes 14 centimeter or more, then it usually becomes palpable. So let's talk about the circulation of spleen. The blood enters the spleen through the splenic artery. So here the main artery, that is the splenic artery. Now after entering the spleen, the splenic artery it gives off the trabecular branch. So from the splenic artery it will produce the trabecular artery, and it enters the spleen and reaches the red pulp. And this trabecular artery at the end, it will produce small branches. These are known as splenic arterioles. So first there is splenic artery, then there is trabecular artery, and after that it will produce the splenic arterioles. And at the terminal portion, these splenic arteries, they will produce splenic cords. And what is special about this cord is that these cords are devoid of any endothelial lining. So it is important for splenic function. Now on the other hand, there are these venous sinuses. These are the venous sinuses, and they will lead to formation of trabecular vein, and finally this trabecular vein will drain into the splenic vein. So the blood that enters the spleen from the splenic artery, then it reaches these trabecular branches, finally it reaches the splenic arterioles and then into the cords. And these cords are devoid of any endothelial lining. And after that, the blood cells, they enter the sinuses, and from the sinuses it will drain into the trabecular vein and finally into the splenic vein. So this is the actual circulation of spleen. And as we know that spleen is divided into white pulp and red pulp, and red pulp is the major portion of spleen, and it comprises about 75% of the splenic tissue, and 25% is white pulp. And actually this red pulp is comprised of these splenic arterioles, these cords and these sinuses. This portion of the spleen, that is the red pulp, and it comprises 75% of the splenic tissue. Now let's have a closer look at this portion of the circulation. So at the center there is this central arteriole or the terminal portion of the trabecular artery, and in the surrounding region, this region is known as periarteriolar sheath. This region is known as periarteriolar sheath, and this region is comprised of the T cells. So in spleen, the T cells, they predominantly reside in the periarteriolar sheath, and the region surrounding this periarteriolar sheath, this is known as the marginal region. So the immediate area of the arteriole, that is periarteriolar sheath, and this area is comprised of the T cells, and the surrounding zone, that is known as the marginal zone, and in the marginal zone there is presence of the macrophages and different types of dendritic cells. So now the question is, where the B cells reside? Now here at the junction of this periarteriolar sheath and marginal tissue, there are presence of these follicles, this round structure, round or slightly oval structures, and this area is dedicated for B cells. So the T cells, they reside in the periarteriolar sheath, the area surrounding the central arteriole, and the B cells, they reside in these follicular structures. These are the germinal centers or the follicular structures. Here the B cells reside. Okay, that's it for now.